Welcome, TRS retirees and families. My name is Jean Gibson, and I represent your dedicated TRS care team at the Teacher Retirement System of Texas. Thank you so much for investing your time with us today. I'm honored to be here. This presentation covers TRS Care Standard, healthcare that TRS meticulously crafted for you, our retired public school employees who have not yet transitioned to Medicare and are under age 65. At TRS Care, we know healthcare isn't one size fits all. That's why we offer comprehensive medical and prescription coverage tailored to your unique needs. Our mission today is simple: engage in meaningful dialogue, address all your questions, and empower you with knowledge so that you can leverage your TRS care benefits to their fullest potential. So feel free to ask questions, engage with our representatives, and make the most of this opportunity. I want to mention an important note for retiring Texas higher education employees. If you're retiring from a Texas higher education system and qualify for a TRS retirement pension, your retirement health benefits could come from Employee Retirement System of Texas, University of Texas, or Texas A&M University. Before you attend this webinar, please do check with your employer to see if you're eligible for their retirement health benefits. If not, you may be eligible to enroll in TRS Care. All right, for those of you new to webinars, let's review a few housekeeping items before we start. All participants will remain on mute during the webinar. If you don't see the handouts panel, select View Handouts in the top menu bar of the control panel. Please take a moment to check your settings and email us if you still can't see those handouts, and we'll be happy to send those to you. During the webinar, please submit your questions through the questions box on the GoToWebinar panel. Our subject matter experts will respond to your questions throughout this meeting, but please do not post confidential information in the chat. We do have 950 registrants for today's event, so our subject matter experts will do their best to answer as many of your questions as possible. But if we don't get to your question, no worries. You can always call us. Once we get to the Q&A session at the end, we'll respond live to some of the more frequently asked questions. And finally, if you have connection issues on GoToWebinar, this is the software that we're using today, please go to their support website listed on the slide. That's support.goto.com/webinar. Today, we'll talk about your 2025 TRS Care Standard plan benefits and give you a chance to hear from TRS and your healthcare vendors. First, you'll hear from Blue Cross and Blue Shield of Texas, your TRS Care Standard Medical Benefits Administrator. Then you'll hear from Express Scripts, your TRS Care Standard Prescription Drug Benefits Administrator. Then we'll host that live Q&A session to respond to frequently asked questions. So before we dive into your medical and prescription drug benefits for 2025, I want to share what's new with TRS Care. TRS Care Standard rates are staying the same for the 8th consecutive year. Your premiums will be the same in 2025 as they were in 2024. TRS Care Standard deductibles will increase in 2025 to align with IRS adjusted guidelines. This change will allow you to continue contributing to and using a health savings account, or HSA. You can read the 2025 TRS Care Plan highlights to see the new deductibles, and those are in your handout section. So 2024 plan deductibles are too low for the plan to be compatible with a health savings account in 2025. And finally, we are excited to announce that dental and vision benefits for retirees and their eligible dependents are coming to TRS Care in 2025. You don't need to be enrolled in a TRS Care health plan to enroll in TRS Care Dental and TRS Care Vision. Enrollment started on October 1st and will end December 7th on 2024 this year. Coverage starts on January 1st, 2025. You can enroll by phone or mail, and be sure to sign up for a separate virtual information session on those two plans, TRS Care Dental and TRS Care Vision, if you want to learn more about the benefits through those plans. There's a link in the handout section called Important Contacts. Look for TRS Healthcare Events on that handout, and that will take you directly to the web page where you can register for that dental and vision info session. So I mentioned in the previous slide that TRS Care Standard has no proposed premium changes for 2025. This slide compares TRS Care Standard premiums for non-Medicare eligible retirees to individual market plans. You'll see that the retiree-only premium for TRS Care Standard is $200 compared to significantly higher premiums for comparable market plans. The same holds true for retiree and spouse premiums. TRS Care Standard is very competitive in the marketplace. In fact, pricing is competitive at 20 to 40% of the cost of individual market plans. Careful plan management has allowed TRS to maintain the same premiums since 2018. All right, I mentioned earlier that TRS Care Standard deductibles will increase in 2025 to account for those IRS adjusted guidelines. This allows us to maintain this plan as compatible with health savings accounts. So this slide just shows the change in deductible amounts from 2024 to 2025 at the different tiers of the plan. Again, these deductible amounts are in your plan highlights in the handout section. All right, well, that's what's new for TRS Care in 2025. Now we're going to hear from Blue Cross and Blue Shield of Texas, who will cover your medical benefits.
Alrighty, thank you, Jean. Hello, I'm Karen Harrison with Blue Cross Blue Shield of Texas, the medical administrator for the TRS Care Standard Plan. Today I will go over your 2025 medical benefits, talk with you about your TRS virtual health options, and discuss ways to get the most value out of your TRS Care Standard Plan. Before we dive deeper into our presentation, here's a quick refresher of your benefits. We will talk about virtual health in detail later, but for now I want to call out the first 3 rows. The key takeaway is that choosing in-network doctors and facilities is the best way of receiving low-cost, high-quality care. Utilizing out-of-network providers will double your deductible and your out-of-pocket. The deductibles and member out-of-pocket increased this year by $50 for individual in-network and $100 for family in-network, and this is due to the change in the IRS guidelines. They increased the deductible, so to keep the plan compatible, we had to increase the deductible also. Preventive care is so important because things caught early are always less severe than when caught later. Plus, in-network preventive care is covered at 100% with no deductible and no copay when you use an in-network provider. One thing we do want you to make note of is that certain preventive care services do have age restrictions, so we want you to make sure that you're checking those age restrictions before scheduling those appointments. Also, routine immunizations are covered at 100% in-network as well, including shingles and flu vaccines. TRS and Blue Cross Blue Shield feel so strongly about the value a PCP brings to your health that we do encourage you to select one, even though this is not required by your plan. The PCP is the single best resource for knowing and understanding one's health. This includes knowledge of your personal health, your family history, risk factors, medications you're taking, and your overall lifestyle. I mentioned how your PCP knows you better than anyone. That means they also know who is the best specialist for you based on cost, distance, ranking in their field, etc. Having a PCP can save you time and make accessing care easier knowing you're going to the right place first. TRS and Blue Cross take the quality and affordability of care provided to you very seriously. The Provider Finder tool now has a way for you to select the best physician that meets your needs. Profiles of highly rated providers have a top performing physician designation, which recognizes those providers in their performance and quality of patient care, medical appropriateness, and cost efficiency. An example of this designation can be seen on the right side of the screen with the blue arrow. The Provider Finder tool empowers you to take an active part in your medical care. It also allows you to locate in-network providers and is available on our mobile app or online. When you search for a provider, you get more than just a list of doctors. You also get enhanced demographic information on each provider. You're able to find out about a doctor's education, hospital affiliations, and whether they're board certified. You also have customizable search options. For example, if you prefer a female OBGYN, you can make that selection and it will filter out only female OBGYNs. Or if you prefer a doctor who speaks Spanish, you can search for one. You can check out patient reviews from what other members have had to say about that physician, or if they have any alternative locations if they practice at multiple locations. Additionally, when you access Provider Finder in the app, you can give it your GPS location and it will give you a list of providers near you regardless of where you are in the United States. Our 24/7 nurse line is a great source when trying to decide which level of care you need at no extra cost. They can provide you peace of mind as well as possibly time and money. The number is on the back of your ID card. TRS realizes the convenience and the value virtual care offers to their participants. Therefore, they offer a choice of two different providers, Teladoc and ReadyMD. Both services give you access to convenient quality care from your home or on the go without having to wait in a doctor's office. Teladoc has an app, whereas ReadyMD requires you to utilize their website through your phone or through your desktop. On the screen, you see two options, but what is the difference? Well, I would typically use Teladoc for common colds, allergies, migraines, or really anything acute and non-urgent. You can also use ReadyMD for these services, but ReadyMD also provides care for muscle and joint pain, strains, and contusions. ReadyMD and Teladoc both provide 24/7 access to board certified physicians. Teladoc cost is $42 per visit, whereas ReadyMD is $30 per visit. These fees are charged to your deductible. However, after the deductible is met, the plan pays 80% and you pay 20%. Also, for non-covered participants, both providers have options for an added cost. Millions of people with mental health disorders never pursue in-person therapy for several reasons. These typically include cost, access to providers nearby, and reluctancy to get help because of the negative attitudes or beliefs about people with mental health issues. TRS recognizes this and has provided several solutions to combat these barriers. TRS Care Standard offers access to mental health virtually through Teladoc for participants age 13 and older. There is a consult fee that varies based on provider specialty. For example, an initial psychiatric session is a $185 fee with $95 for ongoing session, and there's an $85 fee per session for a licensed clinical social worker, counselor, or therapist. These charges do apply to your deductible, and then once your deductible is met, they're covered at 80% and you are responsible for 20%. TRS Care also offers help digitally through Learn to Live at no cost to the participant for ages 13 and up. Lastly, on the bottom of the page, you will see the option of in-person visits. The in-person costs vary by provider specialty and are first subject to deductible, then coinsurance. You also have access to Headway, which is a service that helps locate and book appointments with in-network providers, and you can typically be seen by these providers within 48 hours. TRS offers wellness support through Well on Target, which is accessed by logging in to Blue Access for members. Well on Target offers self-management programs tailored to you based off the completion of your health assessment, which is basically a snapshot of what you are currently doing well and areas in which you could improve your health. We've listed just a few of the programs in the middle of the screen. Think of Well on Target as a personal trainer, a dietitian, or that nagging voice in the back of your head urging you to get moving, all in one and at no additional cost to you. You also have access to the fitness program, which provides tiered membership options for unlimited access to thousands of participating facilities nationwide, varying from gyms and sports facilities to specialty fitness studios and more. You have the option to select between 4 tiers, and there's an option to fit in any budget and fitness with no cost with cost as low as $19 per month with a one-time enrollment fee for in-person. There is also a virtual option for $10 per month. The fitness program is also family friendly, giving access to covered dependents age 16 and older at a bundled discounted price. Blue points are rewarded for engaging in eligible activities and innovative programs tailored to you. We chatted about Well on Target and all the resources available to you through the portal, but these also earn you Blue points. The health assessment mentioned earns 2,500 points and can be completed twice per year. Also, syncing a fitness device such as a Fitbit or Apple Watch automatically applies $2,675 points annually, plus an additional 55 points per day. For the plan year 2025, Blue points will be redeemed for merchant gift cards instead of the online shopping mall. Just by completing a few simple steps, you can be well over 10,000 points by this time next year and well on our way to rewarding yourself for taking an active role in your health. I personally rewarded myself with a smartwatch, which I purchased with my points, and soon you will be able to do the same thing. Now that we've provided an overview of wellness resources, oh, sorry, we're not doing the poll. I want to call your attention to the website noted at the bottom of the screen. You don't need to jot that down because it's also listed on the back of your ID card. This website should be your first stop for medical benefits and any health and wellness information. It is dedicated to the TRS Care Plan and has coverage-specific information that will be helpful to you. Blue Access for Members, or BAM, can be found on the participant website and is the hub for all medical benefit needs. It does require a first-time registration, but it is easy, and once on, you can view claims, explanation of benefits, and check the cost of services covered under your plan. We also have an app that can be used to do almost the same thing as the Blue Access for Members portal. Just search for Blue Cross Blue Shield of Texas app in either the Apple app or Google Play stores, and then you're on your way. Through the app, you can quickly see where you are in your deductible, chat 24/7 with a personal health guide, and can even download a digital copy of your ID card, which is great for those of you like me that can never find it. Lastly, the website and app are also available in Spanish. One of the most useful resources available to you are your personal health guides. Blue Cross Blue Shield of Texas personal health guides are here to help you and your covered family members with finding a primary care doctor, answering questions regarding benefits and coverage, checking the status of prior authorizations or referrals for surgeries or inpatient stays, helping participants understand healthcare costs and options for care, scheduling appointments for doctor's visits, help with navigating participant website and mobile tools, or connecting participants with a nurse to help them learn more about a diagnosis or medical condition and identify resources available in their community. Remember, there is one toll-free number to call, 866-355-5999, which is located on the back of your ID card. A Blue Cross Blue Shield of Texas personal health guide is available to assist you 24/7. That is all that I have for you today, so I will now turn it over to Express Scripts to share information about your pharmacy benefits.
Well, thank you, Karen. Good morning, everyone. My name is Cartier Foster, and I'm with Express Scripts, your prescription drug coverage administrator for TRS-Care. Today, I will go over your prescription drug plan. So TRS chose Express Scripts to administer your prescription plan, but who is Express Scripts? We are a leading pharmacy benefit manager and are proud to provide you access to over 60,000 pharmacies, a convenient home delivery service. Our specialty pharmacy, called Accredo, will take care of any medications that fall under this category. ESI also has a large network of therapeutic resource centers for condition-specific needs, specialized pharmacies, nurses, and other clinicians in 20+ condition-specific therapeutic resource centers. Finally, we'll talk about our simple web and mobile app experience. So we understand that your care should be tailored to your needs. Whether you have short-term, chronic, or specialty medications, we have comprehensive services to fit your lifestyle. For your short-term medication needs, Express Scripts has that network of over 60,000 retail pharmacies. For any chronic conditions or needs, you do have the option to set up worry-free or automatic refills for 90-day maintenance options. For your specialty medications, Accredo will provide, Accredo will provide you that white glove concierge service. So let's go more in depth regarding your home delivery or mail service. This provides the luxury of having your prescriptions delivered to your mailbox to avoid dealing with the public. Express Scripts executes home deliveries daily. Patients get the medications they need safely, quickly, and accurately with Express Scripts Pharmacy. Here are some highlights. 1,000+ specialty trained pharmacists available to speak with 24 hours a day, 7 days a week. Again, therapeutic resource centers for both patients and caregivers needing specialized care. ESI dispenses millions of prescriptions yearly with a 99.99% accuracy rate. Stress-free fills with flexible payment options and automatic refills. And then finally, easy management via our web and mobile app. More about Accredo. Accredo provides specialized patient care for patients with chronic conditions. And Express Scripts has that specialty pharmacy, again, called Accredo. But Accredo is here to ensure you have that white glove service. Some of the things you can expect are individualized counseling and education, proactive monitoring of your medications, direct coordination with your doctors. And then some common specialty conditions that Accredo provides care for include rheumatoid arthritis, hepatitis C, cancer, multiple sclerosis. If you're already receiving care for these, Accredo will contact you. However, if you have any questions on conditions or coverage, we can provide you with contact information for Accredo. We also have 15 condition-specific therapeutic resource centers, or TRCs, allowing us to provide care uniquely tailored to the individual needs of patients with chronic and complex conditions. Some of you may remember Prudent RX. Well, Express Scripts will transition you to Save on SP. It's a new program, but members who are on Prudent RX will get communication from Save on SP about the transition, and Save on SP will cover most drugs that Prudent RX covered. We will work hard to ensure all handoffs are seamless as possible. TRS-Care Standard program offers benefits through participating retail pharmacies, Express Scripts Home Delivery Pharmacy, and the Accredo Specialty Pharmacy. Maintenance medications can be filled for a 31-day or a 90-day supply at any in-network retail pharmacy. You also have a choice to fill your prescription at either the Express Scripts Home Delivery Pharmacy or retail maintenance pharmacies for a 90-day supply. Let's talk about your actual cost share. So starting with your deductible, on an individual basis, that will be $1,650 or $3,300 for a family. We want you to note that these dollars are integrated with your medical at Blue Cross Blue Shield. And we'll apply that same logic with your MOOP or maximum out of pocket. It's $5,650 individual or $11,300 family, also integrated with your medical dollars with Blue Cross Blue Shield. But then when it comes to your actual cost for your medications, whether it's a generic medication, preferred brand, non-preferred, or even those specialty medications, they are all at 20% after deductible. I will call out that the specialty medications are limited to a 31-day supply. We also want to call out how your insulin works. For a 31-day supply of insulin, it's a $25 cost share. For a 90-day supply of insulin, it's a $75 cost share. So one way to save money on prescriptions is to ask for a generic, which typically costs less because the manufacturer didn't have to conduct the initial research or repeat the studies that the first to market branded drug did. In fact, FDA-approved generics can cost up to 85% less. Today, 9 in 10 prescriptions filled in the United States are for generic drugs. So check it out during your next checkup. Before leaving a doctor's office with a prescription in hand, be sure to ask the doctor or nurse, is there a generic drug for that? Also, give your prescriptions a quick checkup. Review all your medications regularly with your doctor or a pharmacist because there may be new lower cost treatments available. Finally, ask about generics before you fill. When you hand over your new prescription to your pharmacist or during a refill or renewal time, ask, is there a generic for that? The pharmacist can tell you, and then your doctor can discuss changing the prescription accordingly. Okay, so I mentioned our technology, and we have an easy medication pricing tool available online at express-scripts.com/TRS-Care Standard. When you visit the page from the home page, simply select Explore Your Plan. On the next page, select Price of Medication, where you can input information about your prescription, name, and strength, and then simply click on Get Prices, and you can find prices before your deductible or post-deductible before you even go to your doctor or pharmacist. Very user-friendly. I also mentioned earlier our mobile app. It's also designed to be very user-friendly. You can download this app, and it doesn't matter if it's an iPhone or an Android in the appropriate marketplace. Simply search for Express Scripts. You can set up the technology as to how secure you want it to be, meaning you can have a biometric security or a code, whatever's best for you. But definitely add this to your favorites. It's a great tool that will allow you to refill with 2 clicks. You can check your order status, track your shipments, and start, stop, and manage all of your prescriptions in a one-stop shop method. Speaking of managing your prescriptions, again, we have a very friendly experience through our website, which is available 24/7. Again, here you can check your order status with tracking, refill a prescription, enroll in automatic refills, find ways to save money, transfer a prescription from a retail pharmacy to home delivery. You can view your claims, balances, and prescription history. You can also get online alerts for prescription-related safety issues. It's very seamless conversion from generic to brand name, meaning we're enabling members to switch from generic to brand before proceeding into checkout, bringing to members' attention any coverage rules that may apply, and presenting you with savings opportunities that are available. So as we wrap up this presentation, I want to leave you with some really great features to help you take control of your prescription plan, or if you have any questions about your account or coverage. The first is our dedicated website, again, at express-scripts.com/TRS-Care Standard. It's a one-stop shop for all your prescription management needs. You can print documents, check your drug costs, and find a pharmacy in your area or anywhere in the country. The second is our customer care team dedicated to TRS, standing by 24 hours a day, 7 days a week. You can reach them at 855-778-1459. Once again, they are a dedicated team of customer care representatives, and they know your plan. So please reach out to them if you need any help with your TRS-Care Standard plan. And don't forget to download our Express Scripts mobile app or call the member services number on your digital ID card. Once again, 855-778-1459. So now we're going to transition back to TRS to lead us in a question and answer session. Thank you all for listening. Thank you for your time and service as educators. We really appreciate everything.